So my name is Amit Kumar. My practice is cardiology, interventional cardiology, and vascular, endovascular medicine. So, cardiovascular disease is the #1 killer worldwide. And when I was a medicine resident rotating through the CCU in my hospital, I took care of a lot of patients, very sick patients with complex cardiovascular diseases like heart attack, heart failure, severe valvular heart disease, complex arrhythmias. And I got truly passionate about taking care and treating those sick patients, making a difference in their lives. So that's why I decided to choose this specialty. So as a cardiologist or interventional cardiologist, I believe in a comprehensive approach towards patient care. I feel like as specialists, we often tend to focus on one specific organ that we train in and don't realize how a certain medication or a procedure can affect other organs as well. So I try to cater towards the patient as a whole instead of fragmented approach just towards organ-based. I try to see as a whole patient. I often collaborate with other specialists, nephrologists and all, because sometimes it can affect the kidneys, my procedures. So I try to be a complete internist as opposed to just being a cardiologist. So in my field, I would say I'm most passionate about taking care of critically ill patients in the ICU. That could be patients with advanced shock, advanced heart failure, complex arrhythmias, complex valvular heart disease, or there could be heart attack, not doing well. So I'm truly passionate about taking care of these very sick patients. So Franciscan, I have been with Franciscan, believe me, since 2016. And their mission, the values, the way they treat patients, the philosophy really truly aligns with my goals. I think that's really great, the way Franciscan is progressing, concentrating the care of all these hospitals, building the centers of excellence where we can treat the patients at the same level, same power as a major academic tertiary center in Chicago. So I think I'm aligned with the goals of advancing growth technology and serving this community. So in the winter time, I would often ski. I go in the West Coast, usually Colorado, Utah. I would ski over there. I do a lot of ballroom Latin dancing. I previously participated in Boston amateur competitions back then. And then I like to travel, learn about different countries, different cultures. I'm very interested in history. I often read books or watch documentaries pertaining to these historical events. And then I'm very much into health and fitness, working out, healthy diet, healthy eating, and educating people, my friends and patients about the same. So the one piece of advice I'll give my patients would be to invest in their own health, focus on diet, exercise, and healthy sleep patterns. And heart-healthy diet, there are a lot of resources they can read about. I give them advice as well. And I also told them to at least spend 30 minutes most days of the week doing aerobic cardiovascular activity.